Are you noticing more frequent trips to the bathroom, waking up multiple times during the night, or struggling with a weak urine flow? You might be dealing with an enlarged prostate, a common issue for men as they age. But how do you know if it's just benign prostatic enlargement, BPE, or something more serious, like prostate cancer? In this video, we're going to break down the top signs of an enlarged prostate, including the ones you shouldn't ignore. We'll dive into how these symptoms can affect your daily life and, most importantly, how you can differentiate between benign prostate issues and something more concerning. By the end, you'll have a clearer understanding of what's going on with your body and when it's time to see a doctor. Stay tuned. You don't want to miss this vital information that could change your health. Basically, the prostate is a small gland located below the bladder, above the rectum, with the shape of a walnut. Its primary function is to produce a portion of the fluid in semen, which helps nourish and transport sperm during ejaculation. The prostate surrounds the urethra, the tube that carries urine from the bladder out of the body. The prostate plays a crucial role in male reproductive and urinary functions. As men reach middle and older age, the prostate tends to enlarge, causing benign prostatic enlargement, BPE, also known as benign prostatic hyperplasia, BPH. This is a normal physiological phenomenon in men, especially common in those over 50 years old. BPH is not cancerous and is not considered a dangerous disease. However, it can lead to many uncomfortable symptoms and affect quality of life, such as frequent urination, urgency, or the feeling of incomplete bladder emptying. When the prostate enlarges, it can put pressure on the urethra, narrowing the urinary flow and stimulating the bladder, causing it to contract more often and forcefully. This leads to frequent trips to the toilet. While BPH is not cancer, its symptoms can overlap with those of prostate cancer, such as difficulty urinating, nocturia, waking up to urinate, or the sensation of incomplete bladder emptying. This makes it difficult to distinguish between BPH and prostate cancer, and it requires doctors to conduct clinical and laboratory tests to make an accurate diagnosis. Therefore, while BPH is not life-threatening like cancer, regular monitoring and examination are essential to ensure good health and prevent potential complications. Early detection and timely treatment can help alleviate symptoms and improve the quality of life for men suffering from this condition. 8 signs you have an enlarged prostate. BPH symptoms: increased frequency, frequent trips to the toilet due to the pressure from the enlarged prostate on the urethra. When the prostate becomes enlarged, one of the most common and noticeable symptoms is frequent urination. This condition, called increased frequency, occurs when the enlarged prostate puts pressure on the urethra, the tube that carries urine from the bladder out of the body. This pressure causes the urethra to narrow, reducing the flow of urine and causing the bladder to work harder to expel urine. As a result, the bladder becomes more easily irritated, prompting frequent urges to urinate, even when it is not full. This frequent urination can occur at any time of the day, but it often becomes particularly noticeable at night, causing patients to wake up multiple times to use the bathroom. This not only leads to inconvenience but also significantly disrupts sleep, causing fatigue and reducing quality of life. Many men with an enlarged prostate report that frequent urination has become a bothersome part of their daily routine, especially when they are engaged in outdoor activities or in situations where restrooms are not readily available. The increased frequency of urination not only diminishes comfort but can also cause anxiety about the ability to control urination, leading to feelings of insecurity and a lack of confidence. Furthermore, if left untreated, the continuous irritation of the bladder can make symptoms worse, impacting both the physical and mental health of the patient. While increased frequency is a common symptom of an enlarged prostate, it can also be a sign of other issues related to the urinary system. Therefore, if there are any abnormal changes in urination habits, it is important to consult a doctor to identify the cause and determine the appropriate treatment. Urgency: sudden and intense need to urinate. Urgency is a key symptom of an enlarged prostate, characterized by a sudden and intense need to urinate that can be difficult to control. This feeling of urgency occurs because the enlarged prostate exerts pressure on the urethra, the tube that carries urine from the bladder, and affects the bladder's normal function. As the prostate grows, it may narrow the urethra, disrupting the flow of urine and causing the bladder to become overly sensitive and more easily irritated. As a result, even if the bladder isn't full, it can send strong signals to the brain, creating the overwhelming urge to urinate. This sudden and intense need to urinate can be distressing and inconvenient, particularly in situations where access to a bathroom may not be readily available, such as during meetings, while traveling, or while sleeping. For many men with an enlarged prostate, this urgency can lead to anxiety and embarrassment, especially if it occurs frequently or unexpectedly. The inability to control the urge can cause a sense of urgency to become a source of significant discomfort and frustration. The feeling of urgency often comes on suddenly, and it may be accompanied by other symptoms like increased frequency and nocturia, waking up at night to urinate. These symptoms can become especially troublesome when they disrupt daily activities or affect a person's quality of life, causing a person to avoid social situations or limit their participation in activities for fear of needing to rush to the bathroom. Additionally, the constant battle with urgency can result in mental and emotional stress, as men may feel embarrassed about the unpredictability of their condition. They may also begin to restrict their fluid intake or adjust their routines to cope with the urgency, but these measures often don't fully alleviate the discomfort. It's important to note that while urgency is commonly associated with an enlarged prostate, it can also be a sign of other medical conditions, such as urinary tract infections, UTIs, or overactive bladder. Therefore, it's crucial to seek medical advice if you experience persistent or severe urgency, as proper diagnosis and treatment can help manage the symptoms and prevent further complications. Nocturia. Waking up at night to urinate, disrupting sleep. Nocturia, or the need to wake up during the night to urinate, is a common and particularly disruptive symptom of an enlarged prostate. This condition occurs when the enlarged prostate presses on the urethra, which affects the normal flow of urine. As a result, the bladder becomes more sensitive and may signal the need to empty itself even when it is not full. In many cases, this leads to multiple trips to the bathroom during the night, significantly interfering with sleep. For individuals with nocturia, the experience can be incredibly frustrating, as it not only causes physical discomfort but also leads to sleep disturbances. The frequent interruptions to sleep can result in feelings of fatigue, grogginess, and irritability the following day. This can make it difficult to concentrate at work or engage in social activities, severely impacting overall quality of life. Some people may even begin to limit their fluid intake in the evening to reduce the need for nighttime bathroom visits, but this strategy does not always resolve the problem and may cause dehydration or exacerbate other symptoms. The link between an enlarged prostate and nocturia lies in the increased pressure on the bladder and urethra, which makes the bladder more prone to involuntary contractions. These contractions may occur even when the bladder is only partially filled, causing an overwhelming urge to urinate. Additionally, as the prostate continues to grow with age, the symptoms of nocturia may worsen over time. In some cases, individuals with enlarged prostates may find that they wake up more than once a night to urinate, further disrupting their sleep cycle. Nocturia can be especially problematic for older adults, who may already have a more fragile sleep cycle due to aging. Sleep deprivation can have a cascading effect on physical health, impairing cognitive function, mood, and immune system response. Over time, chronic sleep disruption caused by nocturia can contribute to anxiety, depression, and a reduced overall sense of well-being. In severe cases, it may even lead to an increased risk of falls or accidents, particularly in the elderly, as they may have to navigate to the bathroom during the night while feeling groggy or disoriented. While nocturia is often linked to benign prostatic enlargement, it can also be caused by other medical conditions such as diabetes, heart failure, or urinary tract infections. Therefore, it is important to consult a healthcare provider if you are experiencing frequent nighttime urination. A thorough evaluation can help identify the underlying cause and guide appropriate treatment, which may include medication, lifestyle changes, or in some cases, surgical intervention to alleviate the pressure on the urinary system and improve sleep quality. Hesitancy. Difficulty starting the flow of urine. Hesitancy, or difficulty starting the flow of urine, is another common symptom of an enlarged prostate. This occurs when the enlarged prostate presses against the urethra, the tube that carries urine from the bladder out of the body. As the prostate grows, it can narrow the urethra, making it harder for urine to flow freely. The result is a delay or struggle to begin urinating, often accompanied by a feeling of incomplete bladder emptying or a weak stream of urine. For many men, hesitancy can be both physically and emotionally distressing. It may take several moments of straining before urine begins to flow, and during this time, men may feel frustrated or anxious. In some cases, the process of initiating urination can become so difficult that men feel they may not be able to urinate at all. This can lead to increased anxiety and stress, which further exacerbates the difficulty. Hesitancy can also be associated with a sense of urgency or the feeling that the bladder is not emptying properly, making the experience even more uncomfortable. One of the main reasons hesitancy occurs is because of the pressure that an enlarged prostate places on the urethra. The prostate surrounds the urethra, and as it enlarges, it can partially block the passage through which urine flows. This blockage causes the initial flow of urine to be slower or delayed. Additionally, the bladder, which is trying to push urine through the narrowed urethra, may become irritated or less efficient at emptying itself completely. This combination of pressure and irritation leads to the sensation of hesitancy. In some cases, the difficulty starting urination may be accompanied by a weak or intermittent urine stream. The flow of urine may start and stop several times, leading to a sense of incomplete voiding. Some men may also experience dribbling after they have finished urinating, as the urethra remains partly obstructed. This can lead to embarrassment or discomfort, particularly in social situations or when wearing clothing that may reveal signs of leakage. Hesitancy can be frustrating and may interfere with daily activities, as men with this symptom may feel self-conscious about their ability to urinate in public restrooms or during travel. Over time, the difficulty starting urination can also lead to increased straining, which can put extra pressure on the bladder and potentially cause additional issues like urinary retention or bladder infections. It's important to recognize that hesitancy, while common in men with an enlarged prostate, can also be a sign of other underlying conditions, such as bladder stones, urinary tract infections, or neurological disorders. If you experience prolonged or worsening hesitancy, it is essential to seek medical advice. A healthcare provider can perform tests, such as a physical examination, ultrasound, or urine flow study, to determine the cause of the symptoms and recommend appropriate treatments. These may include medications that relax the muscles around the prostate, lifestyle changes to reduce pressure on the urinary system, or in more severe cases, surgical options to alleviate the obstruction and improve urinary function. Poor urinary stream, weaker or intermittent urine flow. Poor urinary stream, characterized by a weaker or intermittent flow of urine, is another common symptom experienced by men with an enlarged prostate. This issue arises when the prostate enlarges and presses against the urethra, narrowing the passage through which urine flows from the bladder. As the urethra becomes constricted, it obstructs the smooth flow of urine, resulting in a weak or inconsistent stream. For many men, this means urination becomes a longer, more challenging process, often requiring more effort to fully empty the bladder. A weaker urine stream is typically slower than normal, making it more difficult for men to finish urinating quickly. The reduced pressure during urination can lead to frustration, as the process feels less efficient and can take longer than it used to. In some cases, men may notice that the urine stream is not continuous, instead starting and stopping intermittently, which can cause additional discomfort. The sensation of not being able to fully empty the bladder due to a weak stream may lead to increased trips to the bathroom or the feeling of urgency shortly after urinating. The weak or intermittent flow of urine is due to the mechanical pressure exerted by the enlarged prostate on the urethra. The prostate surrounds the urethra, and as it enlarges with age, it causes the urethra to narrow. This narrowing makes it harder for the bladder to push urine through the urethra with the same force as before, leading to a less forceful stream. The bladder must exert more pressure to overcome the obstruction, and as a result, urination becomes more effortful and less efficient. This symptom can have significant effects on a person's daily life. For instance, men may feel self-conscious about the time it takes to urinate in public restrooms, particularly when using a shared or crowded facility. The constant effort to push urine out, combined with the feeling of incomplete emptying, can also cause anxiety. The physical effort required during urination may lead to increased pressure on the bladder, which could lead to other complications like urinary retention, the inability to completely empty the bladder, or increased risk of urinary tract infections, UTIs. In addition to the emotional and social impact of a weak urinary stream, the physical strain it causes can affect overall bladder health. Over time, if the bladder is unable to empty fully due to the obstruction caused by the enlarged prostate, residual urine can become a breeding ground for bacteria, increasing the likelihood of urinary tract infections. Persistent poor urinary flow may also contribute to bladder stone formation, as the stagnation of urine provides an environment for crystals to form. It's important to note that while a poor urinary stream is a common symptom of benign prostatic enlargement, BPE, it can also be indicative of other underlying health conditions. For example, bladder stones, urinary tract infections, or even nerve damage can result in a weakened urine flow. Therefore, if you are experiencing changes in your urinary stream, it is crucial to seek medical evaluation. A healthcare provider may conduct tests such as urine flow studies, ultrasound, or physical exams to identify the cause and develop a personalized treatment plan, which may include medications, lifestyle changes, or, in severe cases, surgical interventions to alleviate the obstruction and restore normal urine flow. Terminal dribbling. Leakage of urine after finishing urination. Terminal dribbling is the involuntary leakage of urine after finishing urination, and it is a common symptom for men with an enlarged prostate. This condition can be both frustrating and embarrassing, as it often occurs after a person believes they have finished urinating, only to experience a small amount of urine leaking out afterward. For many men, terminal dribbling can affect their confidence and hygiene, as urine leakage may stain clothing and cause unpleasant odors. The cause of terminal dribbling is closely related to the pressure exerted by an enlarged prostate on the urethra, the tube that carries urine from the bladder. As the prostate enlarges, it compresses the urethra, making it narrower and less flexible. This narrowing affects the smooth flow of urine, leaving small amounts of urine trapped in the urethra after the initial stream has stopped. When the muscles around the bladder and urethra fail to fully expel this remaining urine, it results in dribbling. One of the reasons terminal dribbling is common in men with an enlarged prostate is because the prostate surrounds the urethra, and as it grows, it can distort the natural flow of urine. The urinary sphincters, which are responsible for controlling the release of urine, may not function as efficiently when the urethra is compressed. This can cause a delay in the complete emptying of the bladder and leave residual urine in the urethra. Once the individual stops urinating, this leftover urine can leak out, resulting in the characteristic dribbling. The impact of terminal dribbling on daily life can be significant. Many men feel embarrassed about the potential for urine to leak after using the bathroom, especially in public settings or during social situations. The lingering smell of urine can also be a source of discomfort and self-consciousness, leading some individuals to avoid situations where they might feel exposed or embarrassed. It can also affect personal hygiene, requiring more frequent changes of clothing or the use of absorbent pads to manage the leakage. In addition to the emotional and social challenges, terminal dribbling can also be physically taxing. Constant leakage can lead to skin irritation, especially if the urine is left in contact with the skin for extended periods. Some men may experience increased anxiety, worrying about the unpredictability of dribbling, particularly in situations where restrooms are not readily accessible or when they are out in public. There are several management strategies that can help reduce the occurrence of terminal dribbling. In some cases, pelvic floor exercises, such as Kegel exercises, can strengthen the muscles involved in urination and improve bladder control. Medications that target the prostate, such as alpha blockers, can help relax the muscles around the prostate and urethra, making it easier to empty the bladder more completely. For more severe cases, surgical options such as a transurethral resection of the prostate, TURP, or laser therapy may be recommended to reduce the size of the prostate and relieve pressure on the urethra. It is important to note that while terminal dribbling is commonly associated with benign prostatic enlargement, BPE, it can also be caused by other factors, including urinary tract infections, bladder dysfunction, or issues with the sphincter muscles. Therefore, if you are experiencing terminal dribbling, it is essential to consult with a healthcare professional. A thorough evaluation, including a physical exam, urine tests, and possibly imaging studies, can help identify the underlying cause and guide the appropriate treatment to alleviate the symptoms and improve quality of life. Feeling of incomplete bladder emptying. Feeling like the bladder is not fully emptied after urination. The feeling of incomplete bladder emptying is a common symptom experienced by men with an enlarged prostate. It refers to the sensation that, even after urinating, there is still urine left in the bladder. This can lead to a continuous urge to urinate, frequent trips to the bathroom, and an overall sense of frustration and discomfort. Men who experience this symptom may feel as though their bladder has not been fully emptied, even after they've finished urinating, causing them to return to the toilet shortly after they thought they were done. This feeling occurs due to the mechanical changes caused by the enlarged prostate. The prostate surrounds the urethra, which is the tube that carries urine from the bladder to the outside of the body. As the prostate enlarges, it puts pressure on the urethra, causing it to narrow and obstruct the normal flow of urine. The narrowing of the urethra can prevent the bladder from completely emptying during urination, leaving small amounts of urine behind. Additionally, the bladder itself can become overactive due to the pressure, causing it to contract more frequently, even when it's not completely full. This can lead to the sensation that the bladder is still full or not fully emptied. Men with this symptom may also find that they need to urinate more frequently throughout the day or night, as the bladder tries to compensate for its inability to empty completely. This can lead to increased discomfort, disrupted sleep, and a constant feeling of urgency. The frustration of having to return to the toilet multiple times or the feeling that they've missed some urine after finishing can also take a toll on their mental and emotional well-being. Another consequence of incomplete bladder emptying is the increased risk of urinary tract infections, UTIs. When the bladder doesn't fully empty, residual urine can create an environment where bacteria can grow, leading to infections. UTIs are a common issue for men with prostate enlargement, and they can worsen the feeling of incomplete voiding, creating a vicious cycle of symptoms. The sensation of incomplete bladder emptying can be particularly troublesome during daily activities or when traveling. Men may feel anxious about finding a bathroom or unsure if they'll be able to make it to the toilet in time. The constant need to urinate and the difficulty in fully emptying the bladder can interfere with work, social activities, and even basic routines. To address the feeling of incomplete bladder emptying, several treatment options are available. Medications such as alpha blockers can help relax the muscles around the prostate and urethra, making it easier to empty the bladder more completely. Another class of medications, called 5-alpha reductase inhibitors, can help reduce the size of the prostate, thereby relieving pressure on the urethra and improving urine flow. Lifestyle changes, such as reducing fluid intake before bed, avoiding bladder irritants like caffeine and alcohol, and practicing pelvic floor exercises, can also help improve bladder control. In more severe cases, surgical interventions may be necessary to alleviate the obstruction caused by the enlarged prostate. Procedures such as transurethral resection of the prostate, TURP, laser therapy, or prostatectomy can remove or shrink the prostate tissue that is causing the blockage, allowing the bladder to empty more completely and restoring normal urinary function. While the feeling of incomplete bladder emptying is common in men with an enlarged prostate, it can also be a symptom of other underlying conditions, such as bladder stones, urinary tract infections, or nerve damage. Therefore, it is important to consult with a healthcare provider if you experience persistent or worsening symptoms. Through a thorough evaluation, including physical exams, urine tests, and imaging studies, the underlying cause can be identified, and appropriate treatment can be prescribed to alleviate the symptoms and improve overall quality of life. Urinary retention. Severe blockage causing pain, bloating, and inability to urinate. This is a medical emergency. Urinary retention is a serious and potentially dangerous condition that occurs when the bladder is unable to fully or effectively empty. This can be caused by severe blockage, often due to an enlarged prostate, which obstructs the flow of urine through the urethra. When the prostate grows larger, it can compress the urethra, leading to a backup of urine in the bladder. Over time, the bladder becomes distended, and its ability to contract and release urine becomes impaired. The result is a painful and uncomfortable condition that requires immediate medical attention. Men with urinary retention often experience significant discomfort, including bloating and pain in the lower abdomen. The bladder may feel painfully full, and the pressure can cause a feeling of urgency, but no urine can be passed. This condition can be accompanied by an inability to urinate at all, or in some cases, only a small amount of urine may be passed, which is not sufficient to relieve the pressure. In severe cases, urinary retention can cause nausea, vomiting, and a general sense of malaise due to the buildup of toxins in the body, as the kidneys are unable to properly eliminate waste. Urinary retention is considered a medical emergency and requires prompt intervention. Treatment typically involves the insertion of a catheter, which is a thin tube that helps drain urine from the bladder. In some cases, surgical procedures may be necessary to remove the blockage and alleviate the pressure on the bladder. If left untreated, urinary retention can lead to permanent damage to the bladder, kidneys, and urinary system, making it essential to seek immediate medical care when experiencing symptoms. If you found this video helpful, don't forget to like, share, and subscribe to the channel for more valuable health tips. Stay informed, stay healthy, and I'll see you in the next video.